Singapore is taking steps to further ease the pressure on public hospitals and emergency departments, even as daily COVID-19 cases dip. The task force says that it's moving patients and diverting ambulances to other care facilities. Right now, around 92% of the roughly 60,000 infected are recovering from home. Sherlin Xia has this report.
A slight ease on emergency departments from 3,000 patients a day a few weeks ago to 2,800 now. But the health minister says that, in his words, is still very high and healthcare workers remain under stress. To preserve hospital capacity, non-COVID cases are now being moved out to private hospitals and community treatment facilities.
These are non-COVID but stable patients who require monitoring and management of their chronic conditions. And we set up specific facilities, such as an entire hall at Connect and Changi, where these patients can be re-sited. And that will free up capacity and reduce the load in public hospitals as well. So because of all these efforts, we have managed to transfer, on average, 470 patients per day.
Ambulances can also now take medically stable cases directly to these care facilities instead of taking them to public hospitals first. Some CTFs have also been repurposed to admit higher-risk patients. These moves come as those with chronic conditions take up a higher share of hospital beds, around 3/4, over those admitted because of COVID-19. These non-COVID cases form the bulk of workload.
Their condition has deteriorated. It may not be under very good control and they require more care in the hospital setting. Some of these patients may also have had their medical condition gotten worse as a result of COVID-19, even though COVID-19 is not the active problem that led the patient to be admitted in the first place. So in this group of people, the majority may still require care even as our community numbers come down. So we anticipate that our hospitals may still be busy for a fair amount of time.
It could be another 2 to 4 weeks before this improves. Meanwhile, the current Omicron wave seems to have peaked, with the 7-day moving average hitting a high of 18,300 cases around 2 weeks ago. Right now, it's around 16,000. The weekly infection growth rate also stands at 0.93, meaning that cases are steadily going down and expected to halve in 4 to 5 weeks.